Good evening. I'm Nina Weisbord, Chief Advancement Officer at the Katz School of Medicine, and I am thrilled you have tuned into this event this evening. This is one of our favorite events of the year, and it really truly allows us to celebrate you. Although it looks a little different than our traditional scholarship dinner, we hope that you feel our gratitude coming through your screens. We have several student and faculty chat ambassadors tonight, and I'll tell you what that means in just a minute. Awa and Connor, our students, will introduce themselves, as well as Jerry Sterling and Lisa Duncan.
Hi, good evening, everyone. My name is Awa Bakayoko, and I'm a third-year medical student here at Temple. I want to thank each and every one of you for your investment into our future as physicians. I know for me, coming from a low-income background, your support really does help a ton. And so like Nina said, I am one of the chat ambassadors tonight, and I look forward to chatting with you all.
Hi, everyone. My name is Connor Hartzell. I'm also a third-year medical student here at Temple. Thank you so much for your donation. It means the world to me and all of my classmates who received a scholarship. Personally, it makes me feel connected to the Temple community and like someone's watching out for me, which is a great feeling. Can't wait to talk to all of you tonight, and thanks for tuning in.
Good evening. I'm Lisa Duncan, the Associate Director of Financial Aid and Student Affairs. One of my responsibilities is to evaluate for and award scholarships to our students. So when our notifications are sent out, the student recipients are so thrilled and thankful in helping reduce their debt burden because of you. So thank you. I will be available in the chat during tonight's program, so please don't hesitate to reach out.
Good evening, everyone, and welcome and thank you all for joining us this evening. I'm Jerry Sterling, the Senior Associate Dean for Education, Accreditation, and Continuous Quality Improvement. And I work very closely with our student leadership, our curriculum committee, and education deans to make sure that we continue with an excellent education program, even during this pandemic year, so that they will be graduating soon, our fourth-year students, and making sure that they're prepared for the next phase of their education. I want to thank everyone for their generous donations to our Student Scholarship Fund. It really helps our students reach their goals and become excellent physicians. So I do want to thank you for that. And I also will be in the chat. So please find me, and I'd be happy to answer any questions that you have.
Thank you all for those introductions. So a couple of logistics. There's two ways to ask questions. One is the chat, which is on the bottom of your screen. If you're not familiar with Zoom, it says chat, and you can go in there and talk to these individuals, and they will answer you, which is really fun. And then there's also a Q&A function at the bottom of the screen once we start the panel discussion. And if you have a question that you think the whole group could benefit from hearing the answer, please post it there, and we will get the chat to our moderator, Dr. Klaus. If we don't answer your question, we will follow up with you, but we will do our best to field as many questions as possible. So as the chief fundraiser for the Katz School of Medicine, one of the things I always say is that extraordinary gifts come from extraordinary relationships. For all of you joining us, I am humbled by the strength of your relationships with Temple, with our dean, with our team, with our students and our faculty. Your ongoing dedication to the talented and passionate students who embody the future of medicine is truly inspiring. It really is my privilege to extend my deepest thanks to all of you. As we begin our program, it is my pleasure to introduce our first speaker, our dean, Dr. John Daly. Over the past year, he has capably, but I will say inspirationally, led the school through an unexpectedly challenging time, and we are so fortunate to have him at the helm. As a dean and as an alumnus of the medical school, Dr. Daly has long been a champion for increasing access to medical school through scholarship support and funding. Fundraising for student scholarship remains our top philanthropic priority, and Dr. Daly has been a tremendous partner in these efforts because of his deep personal commitment to making medical school affordable and reducing student debt. With that, please join me in welcoming Dr. John Daly.
Thank you, Nina. And thanks all of you for attending this. You know, it was about a year ago that we came together. We bumped elbows together. We raised our glasses. We sat and had dinner. We had some great talks that were given. And we had a chance to sort of shake hands, hug one another, and really be together in person. This is different. It is clearly different. But this last year has been very different for all of us. We all know someone who has been severely affected because of the coronavirus. This event that we're having tonight is really for us, one of the most important events of the year. It's really just a chance to recognize you and to thank you for all of your extraordinary gifts. And so as we discussed all of this, we decided we had to do this and had to do this at this time and use technology to help us. You know, I went to Temple back in the day. I can give you privately the actual year of graduation, but let's just say it was more than a few years ago. In fact, I lived on Allegheny Avenue in a building that's actually now condemned. It has a fence around the whole thing, a wire fence. But it cost little in terms of money. I was able to work part-time at the hospital and during the summers and make enough money to pay my way through medical school. I then got married between my second and third year. And my wife, who was a nurse, she paid my way through the rest of medical school. But nowadays, that's not possible. Student debt is a national issue. We know that now graduating students leave with an average debt load of over $200,000. I mean, think about that, an average debt load of over $200,000. And many leave with more than that in debts. So it carries real consequences for our students. But you've helped us. You clearly have helped us, and we are moving the needle. Medical school needs to be more affordable and more accessible at Temple. And during this pandemic year, donors like you have committed more than $6 million towards supporting scholarships. Amazing. Together, we've increased our scholarship endowment to nearly $38 million. But even with this commitment, we still have a long way to go before we can meet our students' full need. You know, our commitment is high. We allocate more than $11 million annually to scholarships and financial aid. More than half of our students have demonstrated that need. And that's why scholarship fundraising remains my top fundraising priority. But I'm here to speak to you tonight, not just as your dean, but also as a fellow donor. During my first stint from 2002 to 2011, my wife, Mary, who was suffering from cancer, she and I established a scholarship in our names. She was treated in and out of the hospital at Temple, as well as Lincoln, and she was treated often by medical students. She saw them in their third year and their fourth year. And she felt so committed to these young people to help them continue to pay their bills, to be able to attend school, and to be able to graduate, that she told me that we needed to start a scholarship, and we did so in both of our names. She also wanted me to create an award in her name for a graduating senior, which we did as well. But I am committed to not just reducing debt, but I want to widen the access to medical school. This year, I personally committed to establishing a new scholarship fund, the Dean's Scholarship for Diversity and Inclusion, to support medical students underrepresented in medicine. You know, equity and justice have always been central to Temple's mission. This is just one facet of our commitment to being a medical school that embodies that mission. And I can't speak about the impact of scholarship without speaking about our students themselves. You know, this has been for you, for me, for all of us, and for them, a very, very challenging year. Very challenging. We had to turn on a dime for many to go to remote education. Some then were in the hospital caring for COVID patients and non-COVID patients in very challenging times when we didn't have enough supplies. One of the bright spots has been, for me at least, watching them tackle the challenges head on with fire and resiliency. I talk about that word fire in the belly, because that represents our Temple students. In addition to their studies, which they do, they've been leaders in the COVID response efforts across our health system. They have given shots. They helped to open the Leah Chorus Center so that we would have an overflow for patients from our hospital who couldn't quite go home and needed a place to go, and the hospital was too full. These students are your investment in action. They make a difference, and they truly represent what it means to be Temple made. Now, tonight, we have a panel of students that are joining us to speak about their journey to medical school and the memorable moments of their medical school journey. I'm a little bit nervous because I haven't heard what they're going to say. And I run a class every Wednesday for 2 hours with the third-year surgical clerk. So I'm a little nervous about this. Dr. Heather Klaus is our Senior Associate Dean of Faculty Affairs. She's going to be moderating tonight's panel discussion. She's an infectious disease expert. And Dr. Klaus herself has played an integral role in the School of Medicine's COVID response efforts. She continues to do so. She's joined by 3 of our fantastic scholarship recipients. Savoni Moss is an M1 first-year student. Lauren Dondrea is a third-year student. And Brian Kim is a fourth-year student. And Brian himself is looking forward to matching next week when we have match day, and he'll learn where he's going to be able to do his residency training. All 3 of these students are here tonight to represent all of the students who have received your scholarship support. And on behalf of all of these students, they are also here to express their gratitude for your generosity and the impact you have made on their own lives. Now, they're also happy to answer your questions during the panel discussion. Just place them in the Q&A at the bottom of your screen. And again, I do thank you so much for what you've done. You make such a difference in the lives of these students. It is truly a wonderful thing. I want to thank you again. And now, Dr. Klaus.
Thanks, Dr. Daly, so much. And thank you, Nina, and the whole institutional advancement team for setting up such a fantastic event. I'd like to offer my welcome and add my thanks to what has already been said. I think, you know, donors really have such a special relationship to our students, and I'm so glad to be here to celebrate all of you tonight and introduce you to some fantastic student panelists. As has been said, I'd like to remind you that this is meant to be an interactive session. So please, if you have questions that you'd like our student panelists or our student chat ambassadors or Dr. Sterling or Lisa Duncan to answer, please put those in the chat or in the Q&A box for the student panelists. I'd like to introduce again our panel of fantastic students. Savani Moss, a first-year student, Lauren Dondrea, a third-year medical student, and Brian Kim, a fourth-year medical student, pending his match any minute now. They've each taken a unique path to Temple, and I'd like to start by inviting each of them individually to tell a little bit about themselves and why they chose Temple. Savani, let's start with you.
Hi, good evening, everyone. My name is Bonnie Moss, and as Dr. Klaus just said, I'm a first-year medical student this year at Temple University. My path to medical school wasn't traditional, so I graduated Drexel University in 2016 as a nursing major. What I would like to always back up and say is that as a registered nurse, I'm still practicing today. I actually picked up a shift in between studying in the cardiac ICU at the Children's Hospital of Philadelphia this weekend. What made me decide to go to medical school was actually an interesting story. So at Drexel, I shadowed both a physician and a nurse. And in my time with the physician, I was in and out of probably at least 10 patient rooms. I felt like the rapport that was established was there on a respectful manner, but not being able to truly dedicate the time that I wanted to spend with each of my patients to get to know them and their families. And I just overall really really the experience. I liked the diagnostic aspect of it, but it just didn't feel it felt like something was missing. My next experience was the day later. It was shadowing a nurse, and it did happen to be at the Children's Hospital of Philadelphia. And we were able to sit with one patient in ICU and sit with the family and the patient for 12 hours, in times where I got to get to know them outside of what their life was like in the hospital. And I think what really kind of made that impact was the bedside manner that the nurse was able to display, that I felt like the physician I shadowed actually lacked. And in that respect, I'm still actually grateful for that experience, because what it has taught me now, 6 years later as a nurse, is that I can actually do both. And I think that my perspective as a nurse, I've been told at least, is going to help me greatly as a nurse, because I think it was the lack of what was happening with that physician and that patient relationship, not the lack of what a physician can have as an impact on their patients. And so with that being said, in addition to the interest that I have in the pathophysiological aspect of the human body, I decided to apply to medical school. Amongst all of my interviews, Temple was my favorite, which is obviously how I ended up matriculating here, in addition to the gracious donations that I received from you. But I think I was fortunate enough to interview actually in person before COVID really kind of took a turn. And with that, I was able to feel the genuine kind of spirit of what it was like to be in MERB, the medical research building we study in, amongst the faculty and the students, and specifically in OHEDI, which is the Office of Health, Equity, Diversity, and Inclusion. And with meeting with Dr. Melanie Cosby, who's an assistant director, and Dr. Reeves, who's the director of OHEDI, I was really able to kind of get a sense of how impactful Temple really was with, and committed, as Dr. Daly said, to recruiting and retaining diverse underrepresented medicine students. And it just felt like some place that I could really be at home. And so with that being said, I'm just very appreciative of the community aspect that I felt in the interview. And that's how I ended up here.
That's great, Savani. Thanks so much. Lauren, how about you? Okay, I think we're having a little technical difficulty. How about Brian? Why don't you tell us a little bit about why you chose Temple?
Yeah. Hey, everybody. My name is Brian Kim. I'm a fourth-year medical student at LKSOM. I grew up in Los Angeles, California, and I graduated from the University of California, Riverside in 2015. I actually taught ninth grade English and math for a year through an AmeriCorps program while applying to medical school for the first time. And while I did not get into medical school the first time, I was fortunate to be able to come to Temple's Advanced Core in Medical Sciences post-bac program. And since matriculating, I've been able to be part of student government for the last 4 years and currently actually serve as the SGA Executive Board President. For medical school, I wanted to be in a place that would train me for any situation in an urban environment to help treat complex, underserved patients, and Temple has really only reaffirmed my decision to be here. I have met so many amazing physicians, nurses, case managers, social workers, and patients, and have just taught me a lot about medicine and the holistic care that a patient needs, just beyond the scope of giving them a diagnosis and a prescription. I really learned to think about the social factors when talking to a patient, because I've learned that everybody's going to be slightly different and very complicated. You have to not only consider housing, but food security, affordability to medications, and so many other things. And I think because of this exposure, I believe Temple has prepared me in the best way possible to tackle a career in internal medicine. I'm again looking forward to matching next Friday and seeing where I'm going to continue my career. But I'm just hoping to take all the skills and what I've learned here in my own practice when I'm an intern next year and actually treating my own patients. And I just feel like Temple's given me all the tools to be able to do that in the future. So I'm just very thankful for everybody that's here and for helping with my education. And I'm looking forward to talking to you all for the rest of the night.
Thanks, Brian, so much. Lauren, I think we have you back. Why don't you tell us what made you choose Temple?
Yes, so sorry about that. Having some Wi-Fi issues over here, but what is 2020/2021 had a little bit of technical difficulties with Zoom, right? So in terms of why I chose Temple, kind of going back a little bit, I'm actually from California as well. I'm from the San Francisco Bay Area originally. And after I graduated from undergrad, which was at UCLA, I decided to take a couple of gap years and got a job as a healthcare finance consultant in San Francisco. Working that job was a really great experience. I was interested to kind of see the financial and administrative side of the healthcare industry. But ultimately, I preferred the clinical side of medicine and was really excited to, take the next steps towards becoming a physician and getting to work directly with patients. When I came to interviewing about close to 5 years ago now, on my interview day, it was my first time in Philadelphia, and I was pretty daunted by the concept of moving all the way across the country from spending my whole life in California. But just walking into Temple, I really had a great gut feeling about the place. I think everyone I met on my interview day made me feel really comfortable, really at home. And I just left with the best feeling about it. And I think, as we all know, Temple has so much to offer in terms of its resources and its academic and clinical strength. But really what stood out to me about Temple was the people that I met on my interview day, both the students, the student tour guides, the administrative staff who helps run the interview day, the faculty and staff that I interviewed with. I got the sense that everyone cares really deeply and genuinely about the students, about the school, and most importantly, about our patients. I also felt, that some schools, could kind of talk the talk about wanting to serve underserved patients, but I really feel like Temple also walks the walk. We have a genuine commitment to helping underserved patients, which is, falls naturally with where we're located in North Philadelphia. And that was something that was really important to me. And I've found that to be true throughout my, 3 to 4 years here at Temple, is that everyone really does have that genuine commitment to help those most in need.
Thanks, Lauren, very much for sharing that. We have a lot to dig in with the three of you tonight. I'm really excited about it. So, Savani, coming back to you, you mentioned being able to interview with us before COVID really shut everything down. And I'm sure experiencing your first year of medical school during a pandemic was maybe not what you had in mind. I was wondering if you could share with us, what that was like for you.
Yeah, so I was definitely not anticipating a pandemic at all, as I feel like any of us were. But I really would like to start by commending Temple, the deans of Temple, and everyone else that was involved, I'm sure, with kind of like facilitating a hybrid learning model. I do have some friends that go to schools, like other schools in the area in Philly, that were completely online. And just my experience compared to theirs is so drastically different. Just being able to have, like certain things, for example, our doctoring courses are all in person. So the time that we get to spend one-on-one or sometimes in small groups with at least like 3 or 4 of us and with an M4 and one physician from across the street to really be able to kind of delve into physical assessment skills and like working one-on-one with standardized patients who are actors that really come in and like present cases that are real life that we really will see eventually in the clinical settings. And I think that having to do that over an app would be really weird and probably not as beneficial or just over Zoom. So I'm really grateful for that. Additionally, we were able to attend anatomy in person. So we were able to be fortunate enough to receive a donor, which we were able to kind of, get to really get a feel for what the human body was like, see real life applications, and we weren't having to just train over an app. So I think although we have been hybrid, Temple really feels like it wasn't. And maybe that might be because I don't really have anything to compare. So I hope Brian and Lauren can kind of like delve in on that too, or think the same way. But I'm just super grateful. Additionally, I think Zoom has provided its benefits. I was able to kind of meet with different physicians very easily, and which otherwise might not have happened. For example, I was able to leave class and 5 minutes later, hop on a Zoom session and kind of score a plastics research opportunity for a research interest that I have for this summer. And I don't think that would have been possible, being that both the physician and I were nowhere near each other, but we were able to communicate via Zoom. I think lastly, I'm the vice president of SNMA, which is the Student National Medical Association. We have been completely able to be virtual, but also kind of hybrid as well. So something I would like to touch on is SNMA is a group that's committed to diversifying medicine and increasing the number of culturally competent physicians we have. Specifically, SNMA is a group of underrepresented medicine students. With that, we have worked and partnered with Zion Baptist Church, who is across the street. And what we've been able to do, I think, has been really special as Temple is been fortunate enough to be one of the only academic institutions in Philly to receive COVID vaccines. So with the Moderna vaccines, we've been able to have 3 successful sessions now, which we have vaccinated 428, I believe, community members. And this Saturday, we will be giving 200 of them their second doses. And I think that that is something that has been super great and impactful with what we can still do even though we're hybrid.
Savani, that's excellent work. Thank you so much for sharing that. Lauren, Savani spoke about her first year experience. I was wondering if you could talk a little bit more about your third year experience with rotations and if you learned anything unexpected in this pandemic year.
Definitely, good question. So I have a bit of a unique perspective on this because I actually started my third year clinical rotations in the fall of 2019 and then had to take the fall of 2020 off for health reasons and resumed rotations this past fall. So I can kind of speak to, what it was like to be a third year student, both pre and post, pandemic. Well, of course, we've had to make a lot of adjustments due to COVID safety protocols, such as wearing masks, trying not to overcrowd the workrooms, trying to space out during breaks, et cetera. I really feel that overall my clinical educational experience has not been hindered at all based on the, everything we've had to do to adapt to the COVID pandemic. So this past fall, I completed my family medicine, my OBGYN, and my pediatrics rotations. So I actually had a mix of both inpatient, outpatient, and surgical experiences all this past fall. And I can really say that all of those were just as valuable as they had been kind of pre-pandemic, of course, with some slight adjustments and, wearing all of the proper PPE, et cetera. But most importantly, I found that the Temple administration was incredibly helpful and supportive during this time. Of course, it's been a very stressful year, and I can only imagine what it's like to be on the administration side of trying to figure out how to, combine people's schedules so that everyone can kind of stay on track for graduation and for everything else they have going on. But also, waiting until we felt that it was safe to bring students back into the clinical setting. And overall, I felt that our administration was good at staying in constant communication with us, keeping us up to date on what was going on. And at least speaking from my personal experience, they were incredibly helpful and supportive in helping me plan out my schedule when I was returning to clinical rotations after several months off. So yeah, overall, I just feel very lucky that my educational experience has been able to kind of continue relatively unhindered by COVID. And in terms of your question of, what we might have learned from this unusual year, I would say kind of similar to what everyone else has learned this year, which is versatility and just learning how to be flexible and perseverant and adapting to, all the different kind of changes that we've had to overcome. And I think we've definitely learned from that. And I think ultimately my classmates and I, we went into this field to help people. And I think this pandemic has just really, if nothing else, affirmed why we're doing what we're doing and the importance of it.
Thanks so much for that, Lauren. Really appreciate it. Brian, you mentioned you're serving as the Student Government Association president, and Lauren spoke about how supportive the school has been, especially in this particularly special year. Can you talk a little bit about that through your lens as a student leader?
Yeah, definitely. I started my term as SGA president kind of in an inopportune time. It was right at the end of our third year. I just finished my OB rotation, and I was supposed to be starting my family medicine rotation, but then everything kind of got shut down very quickly, and nobody knew what was going to happen next. Our board exams got postponed. Medical students were kind of not considered essential by the AAMC, so we were all taking off rotations and with no exact guarantee of when we were going back. So students, especially fourth year students, were very concerned. Will we graduate this year? Will we be able to apply for residency, finish our requirements? And a lot of our students actually stepped up and decided to use that time very wisely when we were not, on rotations. A lot of the students got involved in the COVID Service Student Board, which was made up of a lot of student leaders that did a lot of different projects, such as PPE requirement, different projects of food delivery and housing. So, and the Leah Chorus Center was a big project that a lot of students that our Temple Emergency Action Corps board kind of spearheaded and kind of helped lead. So there, a lot of students just got involved and really were stepping up to the plate to kind of offer their services to the North Philadelphia community, which was amazing. And luckily for us, we have a very receptive administration and faculty. Dean Daly, Dr. Dr. Sterling, Dr. Reifler, Lisa Duncan, Diane Butera, and everybody involved in student affairs worked very closely with us at the Student Government Association and the student body to talk about the roles of medical students and how we were going to plan to incorporate them back into the medical team. We had weekly town halls and discussions to keep us informed and updated about COVID, about changes to our schedule, how our fourth year would be structured. We were able to maintain almost a completely full schedule. We lost a couple weeks at the very beginning for some of our rotations that got cut from 4 weeks to 3 weeks, but otherwise we were able to still meet all of our requirements in terms of required rotations. We were able to still continue our EM rotations, our ICUs, and everything to get a full fourth year experience. And I thought that was so important to our training going into next year as being interns. And so I think with the help of the advocacy of our school leadership and SGA, we were actually one of the first medical schools in the Philadelphia area to get students back in rotations. And I think we should be very proud of that achievement, that we were one of the first, and we started that trend of getting medical students back integrated into care and on rotations during the pandemic in Philadelphia and beyond. Now, medical students are considered essential by the AAMC. So the next time a pandemic happens, I think we're not going to be pulled off rotations. And I think that was due to the experience that we've gained through this pandemic. And we've shown that medical students have value and are able to make a difference, especially for our patients. So I think our students have stepped up tremendously, and we've been able to show that we're here and we're going to help. And I think that's so important. And I thank our administration and everybody here for helping us through that.
Thanks, Brian, so much for all the outstanding work. And just hearing all of you talk just makes me so proud of Temple, and even prouder than I am at baseline of Temple. So, Savani, coming back to you, you mentioned that one of the positive outcomes of hybrid learning is that you've had more time to volunteer. And I think some of the volunteer opportunities have already been alluded to tonight. I know one of the things you're passionate about is the student run clinic. And I was wondering if you could tell a little more about that.
Yeah, of course. So I've been fortunate enough to be elected to be an executive board member of TEAC, which, as Brian just kind of was talking about, is the Temple Emergency Action Corps. And umbrella under that is the Thrive Clinic, which was developed by, I think, current M4s now a few years ago, which is a clinic that we kind of go to normally. We would go to in person in ODAT, which is One Day at a Time, a men's shelter in North Philadelphia, very close to Temple University. With that being said, we were virtual this year, but that didn't stop them. I think the M2s we have to thank for that. They definitely kind of set the path for our class to kind of continue the mission. And with that being said, we are able to do tele-advocacy as the brand that we kind of came up with. So with that, every Tuesday night, we're able to, after establishing, of course, Wi-Fi, providing tablets. We had a little bit of Wi-Fi hiccups in the beginning, so now we have Wi-Fi hotspots, and we were able to kind of work with them virtually Tuesday nights and kind of really provide like advocacy for them. Meaning, if, for example, a patient comes in, a diabetic patient that really is having some foot problems and is having difficulties being able to get into his primary care physician via the pandemic, what we will do is provide that kind of third-party resource to be able to say, okay, hey, like I'll set up an appointment for you with a podiatrist or a physician, so we can really get that checked out. So there's no barrier in your healthcare. And with that, we set up that appointment. We provide transportation via SEPTA or the public transportation, or even private cars to get them to Temple Hospital or to the emergency room if at times it's been necessary. I think also something I'm passionate about is we also do wellness bags, which is toiletry items, things of which anyone in the with experiencing homelessness might, need. And we drop those bags off in person. So we're actually still able to have somewhat of a contact with people at the shelter, but obviously in a COVID safe manner. And I think that has also been extremely beneficial. Lastly, I think a benefit of COVID that we didn't expect, or the prior class didn't expect either, was the women's clinic is actually down the street. And being the men's and women's clinic are separated for reasons that I think might seem obvious, but they are able to now meet with us virtually in a separate time and in a separate space, which I think is very important. And a lot of the women have actually even spoken up and said that they really appreciate this format, because going into a men's shelter where we would normally only be able to set up in person due to space constraints was very uncomfortable for them. So I think the one thing that being virtual has taught us is that we can actually, maybe keep that around and keep the Wi-Fi spots and the tablets with the women, because we were able to kind of establish a connection with them without having to worry about any space constraints.
Thanks, Savani. Lauren, you referenced your unusual usual section, and I know you're open to sharing some of that with our guests. And I was wondering if you could talk a little about that and how that experience shapes the kind of physician you want to be.
Yeah, so I had previously kind of touched on the fact that I had to take the spring of 2020 semester off. What happened was in January of 2020, I was actually diagnosed with a rare type of brain tumor. Of course, this was really shocking and scary to face, and was also a really kind of strange experience, especially as a third-year medical student, kind of having some introduction to clinical medicine, but not being, fully trained yet, and just that weird feeling of suddenly I'm the one in the patient's, shoes. Like I'm the one now in the hospital bed instead of the one asking the patient how they're doing. I'm the one answering the questions. So it was a very strange experience at first, and luckily I had an excellent care team. I ended up going back home to California for the semester to get care there, and completed surgery and radiation there, and I'm doing well and in full remission. So I'm happy to announce that I'm healthy and feeling back to normal. But it was, a really intense and I would say life-altering experience to go through. And one of the things that I've kind of taken out with me is that it's given me a really unique and invaluable perspective on medicine. The feeling of facing a major operation, as well as the vulnerability of being in an inpatient setting. I think those of us who are in the field of medicine are generally, empathetic, compassionate people who can certainly imagine and want to empathize with someone who's in a position of vulnerability that many of our patients are in. But to actually be in that position is such a different experience. And it's not one I would wish on anyone, but it's definitely eye-opening. I went from being incredibly active and, on the top of my game, getting through medical school, et cetera, to then, being in a hospital bed for a week and not being able to use the bathroom or get up or walk around or even have a glass of water without the assistance of my care team. So that was definitely an eye-opening experience. And I think it's something that will always shape how I interact with patients going forward. One of the silver linings of this incredibly difficult experience has been having a little bit more time and flexibility with my schedule, and having to take that semester off. I'll have this spring semester I have off as well. And that, although at first it was hard to imagine delaying my graduation, I'm now thankful to have that kind of time and flexibility to explore different fields and interests. And one of the fields I'm most excited about right now is psychiatry, which I did at Episcopal Hospital here in North Philly last fall, and really enjoyed. But I'm also interested in emergency medicine, which I'll be doing in my 4th year. So we'll see how that goes. And during some of this extra time, I've been able to get involved with some research with a Temple psychiatrist, Dr. Morrison. We're working on a paper looking at women's mental health, specifically with our population in North Philadelphia, minority middle-aged women. So really excited to be working on that and to have time to explore these various fields before applying to residency this fall.
Thanks so much for your honesty and openness and sharing that with us, Lauren. Really appreciate it. Brian, I'd like to switch gears a little bit. The school has been very vocal this year about addressing the important issue of racial justice. And I know as the SGA president, you played an important role in this work. What has that meant to you?
Yeah, as we all know, social justice is taking the forefront of everybody's mind right now with all the events happening throughout 2020 and even now with police brutality against Black Americans and now with xenophobic attacks against Asian American elders throughout the US. It's never been more apparent to take a stand for the diverse communities that we serve here in Philadelphia and beyond. With the advocacy of groups such as the Student Diversity Council that was created here at Temple and also the Student National Medical Association like Savani is part of, we've been working closely with them as student government to work with the administration at LKSOM and Dean Daly to come out with an official statement to say that we are an anti-racist institution. We will not stand for racism, stigmatization, or prejudice, and we are completely wholeheartedly supportive of our students, and that's a powerful statement to be made at this time. I know as a student here, having a faculty and administration that really is listening to the students and is taking our feedback to heart just shows how impressive an institution the Lewis Katz School of Medicine is. And beyond just statements that are made via email, there's been action also put into place. We were able to secure an additional $5,000 in addition to what we've usually received as student government for our SGA Community Service Board to fund more projects that benefit the North Philadelphia community through student-led initiatives. An example of this is our Philly Connects, which is led by our incoming SGA president, Stephanie Fagbemi, which provides mobile phones and devices to elderly patients in nursing homes and hospitals to be able to contact their loved ones, especially when visitors were restricted at hospitals. So it was a very important initiative to support. And I think we've been able to really give back to the community in one of these ways. In addition, there's currently a commitment to adding more faculty that are Black and underrepresented in medicine to help reflect our diverse student body that we have here. And I know this is just the beginning, but I think the small steps that we've made are essential steps into creating a whole institution that fully supports their students. And I'm just so proud to be involved in this work in my short time as president. And I'm excited to see what future steps are made through this process.
Thanks, Brian. I'd like to take a second and just remind our guests that if you have questions for our panelists, you can write them in the Q&A and they will get funneled over to us. So please do that if something that one of them has said has triggered your question. So before we get to the audience questions, I know each of you wanted to say a few words specifically about what receiving a scholarship meant to you. So Savani, I'm going to come to you and ask you to go first.
Yeah, so again, I just wanted to start by saying thank you to everyone here. Specifically, I would like to say a special thank you to one person that's here, being my mother. Without her and her sacrifice, I wouldn't be here where I am today. With that being said, I grew up in a single parent, low-income family home, with that being said, I was able to be fortunate enough to be able to go to a private high school, which I had to separate from my family. And then I was able to receive academic and athletic scholarship to Drexel University as I became the first generation college grad in my family. And now with you, as donors, I was able to secure a place at the Lewis Katz School of Medicine, and the support that I have is something that I'm extremely grateful for, and without it, I wouldn't be able to be here. And I'm just excited to be able to continue my medical school journey, to be able to continue my medical school journey and be able to eventually one day, hopefully pay it forward and donate back to medical students like myself who are in need.
Thanks, Savani, for sharing that. Lauren, how about you?
Yeah, really just echoing what Savani said. I'm so incredibly thankful to everyone for their generosity. I know I speak for my fellow classmates and myself when I say that receiving a scholarship is just such a breath of relief. It's a weight off our shoulders. You know, when you're applying to medical school, you're excited, nervous, overwhelmed by all the criteria and, you know, the chances that you're going to get in somewhere. It's like a very crazy process. And then once you get in, it's just such an amazing feeling. It's one of the best days of your life, you know, getting that first acceptance. But then you start looking at the finances of it more closely, and it can be really overwhelming and stressful. Just this huge burden of debt that you're planning to assume, even knowing, you know, that there's some job security down the line for physicians, it still can be really overwhelming and stressful to see that those big numbers. So the support of having a scholarship really makes a big impact in relieving this stress. You know, as medical students, we're stressed about everything. We're stressed about our workload. We're stressed about boards coming up, about our rotation schedules, et cetera. And the last thing that you want to be worrying about on top of all of that is worrying about finances. And so having the support of having a scholarship really does make a big difference. So I'm incredibly grateful to you all for your investment in my classmates and myself. And I hope that one day in the future, I'll be in the position to give back as well. And since Savani gave a shout out to her parents, I will say my parents are here as well. So thank you to my family as well for all their support.
Thanks so much, Lauren. Brian, how about you?
Yeah, just echoing Savani and Lauren, I'm just incredibly thankful for the difference that it makes to receive even a small scholarship. Like I said earlier, I had to do an extra year of schooling to be a part of the post-bac program. So just receiving some scholarships helps reduce my overall financial burden. And as I've been reminded by plenty of emails, my time in medical school is coming to an end, and I have to start thinking about paying back my loans rather than just taking them out. And I think looking at the numbers, I just can't help but think about how scholarships have impacted me and reduced my total cost of medical school and afforded me less burden for the rest of my life. And it's just been giving me a lot of more flexibility to think about like relocation costs, planning for residency, and my own like personal life goals of like starting a family and things like that. So it's powerful to know that there are both alumni who have been in my position in the past, and there are people that don't even know me who have been supporting me and my classmates. And it's just so warming to know that there are just people out there that are willing to support medical students like myself. So I'm just eternally grateful to you all. And again, like everybody said, that's this is how I hope to personally give back to my Temple community someday, especially to the institution that has given me so much and given me everything I could have asked for as a student. So thank you, everybody.
Thanks, Brian, and everyone. So another final reminder, if you have questions for our panelists to put them in the Q&A. I would like to start with one question that I'll pose to all of you, but maybe Brian, coming to you first. How has COVID changed your perception of the practice of medicine?
Yeah, I think COVID has given us a lot to think about, right? It's forced us to think about how do we distribute care equitably to our communities. We've learned, this vaccine rollout has been so enlightening, I think, to me about how we're distributing the vaccines and how we need to impact our communities, especially here at Temple. I think there was a study that came out recently that showed, that only less than 5% of Black people in Philadelphia were being vaccinated, compared to 60% of white people in Philadelphia by the Rite Aid distribution. And I think that's just completely unacceptable in these times. So I think we just need to look back and look at ourselves and how we're thinking about medicine and how we're going to distribute out care. But also, how do we expand and use the technology that's kind of given to us? We're connecting to people all across the United States probably right now via Zoom. How do we integrate this care for our communities? How do we integrate telemedicine as a better way to just for people that can't make it to the doctor's appointments? How can we improve our physical exam maneuvers, and how do we take better histories over the phone? How can we improve in these different ways? And I think we have to embrace what COVID has given us in these times and improve care for the future.
Thanks, Brian. Savani, question got directed to you. What was anatomy class like with the COVID restrictions?
Yeah, so essentially what happened was they kind of ran the same way that it always had. The difference being that instead of being in group of 6 per donor, we were in groups of 3 per donor. So it kind of honestly gave us, like, I guess, a more personal connection with the donor than maybe the prior classes have had. With that being said, we alternated days. So we had groups A and group B, and we were able to alternate days where we went into the anatomy lab. And then if you were on the day that you were in the anatomy lab, you were in person still, but with the professors kind of doing a conference style learning via PowerPoints and reviewing kind of what we would be doing in the lab and doing some sort of self-study. But then the next day was more so on us to kind of go back and be like, okay, if I was group A, for example, and group B was dissecting, I would go back and see what group B did and like be able to kind of talk through amongst my group and say, okay, this is what they dissected, because we actually got to be able to look at it via PowerPoint slides, discuss with professors in small group learning and discussion, and then be able to kind of go back to the body and kind of be able to compare before doing our dissection. And it kind of went back and forth like that throughout the semester. So I think overall, we didn't really miss out at all. I think if anything, we might have even gotten dual learning experiences, being that we kind of got double reiterated. I'm not sure if Brian and Lauren feel differently, but we were able to kind of like get a lecture style like format and then able to go back and like review twice over on the body. So it was amazing.
Thanks for answering that. Lauren, someone was wondering, are there any positive changes, in your opinion, to clinical care or clinical practice as a result of the COVID pandemic?
This is an interesting question. I think that we've touched on a couple of the changes that have happened because of the COVID pandemic. I think one of them being the efforts that I think Brian had mentioned, one of our classmates, Stephanie, had done in terms of trying to increase patients' access to technology that they can use to connect with family at home. One of the things that I really thought about a lot towards the beginning of the pandemic was that I had gone through my surgery and my hospitalization less than 2 months before everything kind of was on lockdown because of the pandemic. And I was so incredibly thankful to have the opportunity for my close family and friends to be able to come visit me in the hospital and provide support to me during that time. And when I heard about the pandemic and the fact that guests wouldn't be able to visit their loved ones in the hospital, that to me felt like it was going to take a really big toll on patients' ability to heal and to have a positive outlook, which I think is so important to their recovery. And so hearing about some of those efforts that our classmates have done, I think makes a really huge difference. And I hope that that'll continue, because even when, we're allowing family back in the hospital, not all patients will maybe have the opportunity for their family to come in for various reasons. So having those kind of supports built into place that can continue post-pandemic life, I think is really important. I think another thing, in a weird way, because we're all, feeling isolated in different ways because we can't all physically be together, the fact that you could still see patients in person, I felt that patients were so appreciative to have that face-to-face contact with providers. When I did my family medicine rotation, I was seeing a lot of patients who had been coming to that same clinic for years and years. And I really saw how important those relationships were to the patients and how much of a difference of seeing someone in person and, just the simple comfort that you can provide to a patient in person that sometimes gets lost with technology, I think has been really interesting to see.
Thanks, Lauren. Brian, I was wondering if you could take an add or add anything to that in terms of positive changes in clinical practice or in the hospital as a result of COVID.
I think it's kind of forced us to, also, figure out like how can we be a little bit more, not so linear in our thinking, right? How do we branch out from? I think a lot of the cases, especially when I was in the emergency department, were just like, if you see a respiratory case, is it COVID, right? And I think we got kind of stuck in that kind of that thinking, that kind of general bias that we were like appreciating. And I think it's forced us to kind of be more creative in how we approach, how do we approach treatment of patients? How do we make sure that, okay, if we rule something out, what else is the options? What are the other possibilities that are out there? So it's kind of forced us to be a little bit more creative and, allowed us to, push out amazing things such as like the vaccine that has come out this year. And I think it's just shown how far medicine and science itself has come to be able to push out something this widespread throughout the United States. And it's just shown the power of science and just believing in the results of what we've been doing and kind of forcing us to kind of make choices and make decisions in order to, provide better care. I think Temple and Philadelphia in general has done a great job in the pandemic in supporting their residents and their attendings and the medical students and being, allowing for mental health breaks and providing time for people to kind of reevaluate and take a breath. So I think, overall, I think there's just been a overall heightened, kind of embrace of wellness and taking care of our healthcare workers all across the country. So I'm very thankful for that.
Okay, one final question. Savani, this is coming to you. Any words of wisdom to undergraduate students or working professionals who are considering medical school at Temple or elsewhere?
I guess my word of wisdom would be, that's kind of hard. I guess take your time with your decision. I think most importantly, what you need to decide upon is community. I think a word that comes to mind is kind of togetherness. I think something that we've been able to experience in the pandemic is, especially even as like a nurse, was that, COVID, although it was isolating, it also brought us as healthcare professionals together. Although there's a lot of interdisciplinary teams and things like that that have always worked together, I think it really just kind of brings us like closer and really kind of allows people to, really reach out and feel what you're feeling, because it was something that everybody was affected by in some way, shape, or form. So I think with that being said, as an aspiring medical student, I would tell them to really like make sure that the school that you decide on has a very strong community, both within the students that are there, but also with the faculty and staff. I think Temple would be a great institution to do that because we're very fortunate to have everyone up from Dean Daly who take the time out of his busy schedule to kind of sit down with us several times a month if necessary, or after something happening that might be, very impactful on certain student populations, to kind of have lunch with us and really just be able to talk and hear our stories and address us by first names and really get to know faces, even though we're only virtual. So I think that that would be kind of what I would say. Just make sure that you pick someplace that really gives you that communal feeling and is able to provide for your mental health and for your kind of like overall joy and happiness as you go through medical school, because any institution will probably provide you a great education. But I think it's something that's very unique to Temple to be able to provide that kind of level of comfort and togetherness.
Thanks so much. I'd like to thank all our panelists, Brian, Lauren, and Savani, for just a fabulous discussion. I know it's very inspiring to me as a faculty member and as a member of the Dean's staff. I'd like to turn the program now back to our Dean, Dr. Daly.
Thanks, Heather, Dr. Klaus, and all of the panelists. You all are absolutely fantastic. It was both wonderful and impactful for me to hear your stories. And I am so very proud of you and what you all have accomplished. And I surely look forward to see what you're going to be doing as your careers evolve. I can tell you back in October of 2019, when President Englert asked me to come down to his office for a sandwich, that he broached the subject of becoming dean, and you are the reason I said yes at the end of the day, because I just think so much of you and who you are, where you've been, what you're doing now. You have that fire in the belly, and I'm so very proud of you. I would like to thank the institutional advancement team. They're a great group of people with terrific leadership by Nina Weisbord. I want to thank them for putting this together. We're grateful to each of you, our donors, for all your support. I hope that what you heard tonight demonstrates that your giving really does make a difference. One of our priorities in the past 4 years has been also building our planned giving program. So if you haven't received $1 billion from the $1.9 trillion act that was just passed, you can also think about planned giving. We really want to help you and you help us to make a legacy gift through your estate if that's possible. It will have a far-reaching impact on our scholarship program. Over the past few years, these planned estate gifts have increased to more than $19 million pledged for our future students. And this special group of donors truly advances our commitment to supporting our students for many years to come. Now, as we sign off, I'd like to leave you with a short video expressing our students' gratitude for all you do. At the close of this video, we'll end the program tonight. I do want to thank you again for joining us. I really do wish you well. Please stay safe, keep well. Should you ever need any healthcare advice, you're welcome to call me. And if I don't know, I'll get one of our fantastic faculty involved as well. So thank you all very, very much. Again, thanks for all you do. Enjoy the video and good night.
Hi, my name is David Quintero. I'm a fourth year going into anesthesiology. I chose to come to Temple because it radiated a sense of family and community. Your gift truly embodies the spirit of Temple. Thank you so much for your gift.
Hello, my name is Chidamelum Alpanano, and I'm a third-year medical student hoping to match into general surgery. And I just wanted to say that this year has been difficult to say the least, but it's also been a time for growth and change and a time to support those around you. And I just wanted to say thank you for supporting me and giving me the opportunity to be the change that I wish to see in my own community. So thank you.
Hi, my name is Rebecca and I'm a current 4th year medical student at Temple and I'm applying into OBGYN, and I just want to thank all the donors for their generosity and for thinking of us and supporting us. It means so much to know that someone who came before us and made it through is now looking back and thinking about us and supporting us. It means a whole lot, so thank you so much.
Hello, my name is Deli Durjaya and I'm a first-year medical student here at Temple from Baltimore, Maryland. I chose Temple because I've always felt so supported by the faculty, staff, and administration, even more so now through receiving this scholarship. So I'd like to just end this video by saying thank you.
Hi, my name is Steven Segarra and I'm a first-year medical student. At the beginning of the school year, I faced a financial hardship that jeopardized my ability to continue studying medicine. But thanks to your generosity in these scholarships, I'm now able to continue pursuing my dreams of becoming an ophthalmologist. Thank you.
Hello everyone, my name is Tamika Queen and I'm a 4th year medical student going into pediatrics. I just want to say thank you to all of the scholarship donors. For one, thank you for believing in me and for providing your continued financial support in order for me to achieve my ultimate goal of becoming a physician. Words can express my gratitude. Again, thank you.
My name is Jordan Rojas and I'm a first year medical student who's currently interested in psychiatry. I just want to say thank you all so much for the support and generosity that you've shown us. Us Temple students are truly blessed to have such an amazing community standing behind us.
Hi, my name is Ivana Kohut. I'm a 2nd year specialty undecided. I wanted to take a moment to thank you so much for your generosity and the scholarship funds. I've always wanted to become a physician advocate, specifically in Latin communities like the ones where I'm from, and I really can't imagine becoming a physician advocate at an institution other than Temple. Thank you again so much.
Hi, my name is Tyler Wilps. I'm a 4th year medical student at the Lewis Katz School of Medicine, going into orthopedic surgery. And I just want to take a moment to thank you, all the donors, for being so generous and really taking a huge burden off of our shoulders and allowing us to focus on our studies and on giving back to the community as well. So again, just thank you so much.
Hi, my name is Randolph Blyden. I'm a 3rd year medical student. I'm interested in family medicine or internal medicine. I chose Temple because I'm from the Philadelphia community and it was important to give back to community in which I grew up. Thank you so much for your gift and donation, and thank you for continuing to support students like myself.
Hi, this is Rhiannon McGrath. I am an M3 at Temple. I'm currently on my OB-GYN rotation. And I just wanted to say thank you so much for this scholarship. It's given me the opportunity to pursue my dream, something that I've wanted to do since I was really, really little. So thank you so much.
Well, hello everyone. My name is Jordan Juarez and I'm a 2nd year MD MBA student at the Lewis Katz School of Medicine at Temple University. I just wanted to thank you again for supporting our community. Ever since I was young, I've always wanted to contribute to the health of my Hispanic community, and I feel that Temple has provided an incredible array of opportunities to address healthcare inequities. Thank you again, and go Owls.
Thank you.